Hello friends, today we discuss about healthcare economics in healthcare management system MBA. So why health economics is important? Why should working healthcare managers study economics? This simple question is really two questions. Why is economics valuable for managers? What special challenges do healthcare managers face? These questions motivate you. Why is economic valuable for managers? Economics helps managers focus on key issues. Economics helps manager wide through the dulge of informations. They confront and identify the data they need. Economics outlines strategies for realizing goals given the available resources. One of the primary tasks of economics is to explore carefully the implications of rational decision making. Economics gives manager ground rules for strategic decisions making. When rivals are not only competing against them but watching what they do, managers must be prepared to think strategically. That is, be prepared to use the insights of game theory. Economics gives managers a framework for making sense of cost. Managers need to understand cost, as good decisions are unlikely without these understanding. Economics gives managers a framework for thinking about value, the benefits of the goods and services successfully organizations provide to customers exit the cost of producing those goods and services. Good managers decide, require, and understanding of how customers perceive value. Most important, economics uh, sensitize managers to fundamental ideas that affect the operations of every organization. Effective management begins with the recognitions that consumers are sensitive to price difference, that organization compete to advance the investors of their stakeholders, and that success comes from providing value to customers. Now, economics as a map for decision making. Economics provides a map for making. Maps do two things. They highlight key features and suppress unimportant features also. To drive from Des Moines, you need to know how the major highways connect. You do not want to know the name and locations of each street, each town you pass through. Of course, what is important and what is unimportant depend on the task at hand. If you want to drive from Birch Street to uh, Olet, so you the map that describes only the interstate highway systems. So, like a map, economics highlights some issues and suppress others. For example, economics tells managers to focus on incremental cost, which makes understanding and managing cost much simpler. But economics has little to say about the brief system, the motivate consumer behavior. If you are seeking to make therapeutic regimens easier to adhere to by making them more consistent with consumers' belief system. Economics is not a helpful map. If, on the other hand, you want to decide whether setting map an urgent care clinic is financially feasible, economics helps you focus on how your project will change revenue and cost. Economics also gives managers a framework for understanding rational decisions making. By rational decision making, we mean making choices that further one's goal given the resources available. Whether those goals include maximizing profits, securing the health of the indigent, or other objectives, the framework is much the same. It entails looking at benefits of costs to realize the target or largest net benefit. We will explore these questions further in sections. So, managers must understand cost and be able to explain cost to others. Confusion about cost in common, so confusion in decision making is also common. Confusion about benefits is even more widespread than confusion about cost. As a result, management decisions in healthcare often leave much to be desired. Economics or economists typically speak about economics at a theoretical level, using perfectly competitive market which are for the most part mythical social structures. So, as a model which makes application of economics different for managers competing in competing in real world market. Yet, economic offers concrete guidance about pricing, contracting, and other uh, quandaries that managers face. Economics also offer a framework for evaluating the strategic choices managers must make. Many healthcare organizations have rivals, so good decisions must take into account what the competition is doing. Will it give your rivals a low cost way of seeing what works and what does not? Will buying primary care practices bring you increased market share or buyer's remorse? Knowing economics will not make these choices easy, but it can give managers a plan for sorting through these issues. Now, special challenges for healthcare managers. What special challenges do healthcare managers face? For five issues face healthcare managers more than other managers. So, first, most purchases were knee jerk responses to what competitors were doing rather than well thought our business plans, and enamored by the fact that physicians typically generate large impatient revenue for each dollar of outpatients revenue they generate. Hospitals neglected to ask two key questions: how will buying these practices change the amount of important revenues physicians will bring us? Why are physicians willing to sell? They will do not know the answer to the first question. The question to the second question is simple. Hospitals overpaid. They started buying just a practice. Valuation began dropping as a result of the growth of managed care and increasing competition for patient. Second, hospitals ignored incentives. Most hospitals covered or converted compensation based on billing to salaries after they require practices, which was a significant mistake. Economics reminds us that incentives matter for physicians whose earning depends on billing, the marginal patients. The patient squeezed in at the end of the day, or the patient booked in anticipation that someone will cancel, is highly profitable for physicians whose earnings depends on salaries. The managerial patient is the marginal patient is financially unrewarding. Not surprisingly, physicians in independent practice saw 28% more patients and performed 16% more procedures per patient than those in practices owned by hospital. Now managers of multi-care health system concluded that continuing losses. So the risk and uncertainty. Risk and uncertainty are defining features of healthcare markets and healthcare organization. Both the incidence of illness and effectiveness of medical care should be prescribed in terms of probabilities. For example, the right therapy provided the right way usually carries some risk of failures. A proportion of patients will experience harmful side effects, and a proportion of patients will not benefit as a result. Management of cost and quality presents different challenges. Has a provider produced bad outcomes become he was unluckily and had to treat in extremely sick panel of patients, or become he encountered a panel of patients for whom standard therapies were influence or ineffective. Did his colleagues let him down, or was he incompetent or lazy? Now, insurance. Because risk and uncertainty are inherent in healthcare, most consumers have medical insurance. As a result, healthcare organizations have to contend with the management problems. Insurance presents. First, insurance creates confusion about who the consumer is. Customers use the products, but insurance plans often pay most of the bill. Moreover, most people with private medical insurance receive coverage through their employer, in large part because the tax system makes this arrangement advantageous. Although economics generally agree that employees ultimately pay for insurance via wage reduction, most employees do not know the cost of their insurance alternatives, and unless they are changing jobs, have limited interest in finding out. As a result of the employer plan default, employees remain unaware of the true cost of care and are not eager to balance cost and value. If insurance is footing the bill, most patients choose the best, most expensive treatment, a choice they might not make if they were paying the full cost of care. In addition, insurance makes even simple transactions complex. Most transactions involve at least three parties: the patient, the insurer, and the provider, and many involve more. To add to the confusion, most providers deal with a wide array of insurance plans and face blizzards of blizzards of disparate claim forms and payment system. Increasing members of insurance plans have negotiated individual payment system and rates. So many healthcare providers look wistful at industries that simply bill customers to obtain revenues. The complexity of insurance transactions also increase opportunity for error and fraud. In fact, both are fairly common. Despite these bewildering array of insurance plans, many providers still rely on a select for plans for their revenue, a circumstance most managers seek to avoid. For example, most hospitals receive at least a third of their revenue from Medicare. As a result, changes in Medicare regulations or payment methods can profoundly after a healthcare organizations and prospects. Overnight, changes to reimbursement terms may transform a market that is profitable for everyone to one in which only the strongest, best positioned organizations can survive. So that's the end of the video, my friends. If you like my blogs, please subscribe, share my channel. Thanks again for watching.